So how do we know when we have kidney disease? Well, often we don't know, and that's half the problem. Your kidneys are pretty good at compensating when things aren't going so well.
In the early stages, symptoms may include a change in how often and how much urine you pass, particularly at night. As the CKD progresses, you might experience tiredness, loss of appetite, shortness of breath, and a feeling of being generally unwell. But the reality is, you may not notice any symptoms at all until the CKD is quite advanced.
But while you may not be able to see your CKD, your GP can.
At the Woodlands practice in Chadderton, Oldham, Dr. Ian Wilkinson is a GP specialist in CKD.
We've looked on kidney disease in the past as being related to dialysis and to well-established kidney problems. But what we are very interested in is finding those patients who have relatively early kidney disease and helping to prevent the future problems that can arise by promoting good health and by managing those risks well in primary care. Chronic kidney disease is diagnosed based upon a blood test. It's a relatively simple blood test and it's based upon what's called serum creatinine. And from that particular test we can actually do a calculation which gives us something called the estimated glomerular filtration rate, or EGFR for short. So anybody who has an EGFR of 90 or 90% has perfectly normal kidney function. And it's only below that that we actually recognise chronic kidney disease as such. We have to look on chronic kidney disease as a risk factor, similar to the way we would look on high blood pressure or a high cholesterol. And in those terms, if we explain to patients that it is a risk that needs managing, because what we're trying to do is keep patients healthy for the future and also to prevent any other associated illness occurring. We wouldn't expect a patient on the first consultation to be told you must lose weight and you've got to stop smoking and you've suddenly got to increase exercise. We've got to actually tailor a programme of lifestyle changes for that particular patient over a period of time. There are lots of issues that we need to work through, and so that you will need to establish a good relationship with your general practice team, who will be helping you through what initially can be a very difficult worrying period.
CKD is graded in stages 1 to 5 according to your EGFR.
Stages 1 and 2 don't really represent a serious problem, with EGFR not far outside normal levels, but perhaps with some kidney abnormality present. If you have an EGFR between 30 and 59, then your CKD is at stage 3. Around 1 in 20 people will be at this stage. At stage 4, EGFR is between 15 and 29, and at stage 5, the most advanced level of CKD, your EGFR is under 15. One of Dr. Wilkinson's regular patients is Rabina Latif. Rabina is 48. She has diabetes and CKD, which she's been successfully maintaining at stage 3 for many years.
When I was first told, I thought it was progressively going to get worse, and then I'm going to end up on kidney dialysis, and then they're going to tell me, oh, you need a kidney transplant, and I'm thinking, oh my God, you have to go to your GP, you have to seek that information.
Good afternoon. I've got an appointment with Dr. Wilkinson. What time's your appointment?
2 o'clock. You need to tell them how you feel, whether it's emotional, whether it's medical. You have to tell them, and if they can keep an eye on you and they can sort of assess you, it's more beneficial, because I think that's what's kept me so well for so long.
Right, how have you been since I last saw you?
Yes, I'm well.
Can you remember what your last EGFR was?
No.
35% at that time,
Right.
which actually was slightly improved on the previous
Right.
time,
Yeah.
which is obviously good. In general practice now, we do tend to work very much as teams. It's about the whole team delivering a good service to people like Rubina, and that includes the practice nurses, our healthcare assistants, and other people such as dietitians who we can actually arrange to come in and help to give advice to patients.
They organised evening with a dietitian at her surgery, and we could go and talk one-to-one and discuss the difficulties sometimes people have in adjusting, making changes with their diets and things.
Always confident.
Always confident. Quietly confident.
Quietly
yeah.
confident.
Yeah.
You can't sort of constantly carry a book around watching the calories and fat content. If you're sensible about it, I'm sure you can treat yourself now and again. I mean, I like my fish and chips. If I could, I would have it every week, but I don't.
Just make sure you're comfortable. Okay. It'll come quite tight and then it gives us a reading.
Okay. Yeah.
It's just a little bit off target today. It's 164.
Right.
Okay, so I'll put that back to the doctor and see what he says about it.
It's very important we monitor Rubina's blood pressure on a regular basis and try and keep it to the agreed target that we have with her. We also need to regularly monitor her kidney function, for which obviously she needs a regular blood test. And often at the same time we'll check her blood count because there is an association with kidney disease and anemia, so that's something we would like to check regularly. And we also tend to check her mineral levels in her blood because chronic kidney disease again can affect the bones. Her cholesterol is also checked probably on an annual basis because that's an associated risk factor as well. So we do like to keep these checks ongoing and regular, and Rubina does come along to the surgery on at least a 6-monthly basis currently.
Yeah.
So that's our result line number there, and
Right.
then all the tests we've done today for you.
Okay,
Okay.
thanks. Having a kidney disease does not put your life on hold. If you have a bit of positive thinking, if you plan a little, plan ahead, you can do many, many things.
I think it's important for patients to understand that although they may have been given a diagnosis of chronic kidney disease, that actually in the long term they can remain stable, they can remain healthy, but it does involve them as individuals changing their lifestyles appropriately and us as practices supporting them in that.
With my GP's help, with my family's help, yes, I think the outlook is bright.